1998 from the Department of Pharmacy, Faculty of Mathematics and Natural Sciences, from Andalas University, and a PhD degree from the Institute of Biosciences, University of Putra, Malaysia in 2009. And now she works as a lecturer at the Faculty of Pharmacy, Andalas University, and her research interests are in biological study, especially cytotoxic and anti-inflammatory activity of Sumatran plants, including genus Garcinia and Nigella sativa.
Good morning, everybody. Sorry for inconvenience because I lost my voice the first day I arrived in China. But I do my best. Okay, let me introduce myself. My name is Wahyuni from Andalas University, and today I will present part of my research under the title "The Effect of the Cumin Oil for Controlling Asthma and Blood Eosinophil Level in Asthma Patients in Djamil Hospital in Padang." Padang is the city of West Sumatra in west part of Indonesia. Sorry for the sexy voice. For my introduction, I started with the use of the herbal medicine or natural product. As I mentioned from the previous presenter, this species also active for anti-cancer. Right? So, started for herbal medicine have been used for humans for thousands of years to treat medical illness or to improve physical performance. And recent years, there has been growing interest in alternative therapies, like we hear from the yesterday presentation. And the therapeutic use of the natural product, especially derived from plants. And despite the move for the synthetic medicine, the traditional plant-based medicine still play in the important role of the world of medicine. We know so many synthetic medicine come from the naturally occurring compound. And extremely 80% of the world population use plant-based remedies for the primary form of healthcare and the world market of herbal medicine based on the traditional knowledge, and estimated at 60,000 million US dollars, quite many. And for my research background, we will starting with because it's correlated with the asthma. What is the asthma? And also I will show the epidemiology and also the pathogenesis and approach of study for the asthma. Starting with the disease first. Asthma, the word of asthma was originally from Greek language, which means the short breath. Hopefully this is not asthma symptom. Because no wheezing. No wheezing. So, asthma was defined as a clinical condition of reversible and periodic respiratory tract obstruction. And the main pathology concept of asthma is the inflammatory process, chronic inflammatory process, and related to many factors, especially mast cell, eosinophil, lymphocyte T cell, and will cause some clinical symptoms such as oppressive tongue, cough, and chest pain. Hopefully, this is not asthma. So, the immune modulation system is one of the therapy which considered as promising therapy for patients with asthma. I think you agree, right? For epidemiology of asthma, according to the GINA is Global Initiative for Asthma, globally there was an elevation of the prevalence, morbidity and mortality and economical burden of the asthmatic patients over the last 40 years. And asthma affects more than 300 million people worldwide. And some reports show the asthma prevalence was rising about 50% every decade. So it's quite a big value. And asthma controlling program is becoming important problem to be solved, because asthma cannot cure, but we can control asthma. Asthma is chronic disease, so the controlling is very important. So, like I said before, asthma is caused by inflammation in the airways, and the line of the air passes well, and the muscles surrounding to the airway become tight, and this reduces the amount of the air that can pass through the airway, so they become short breaths. And two groups of medicine for asthma actually. One group is for control the asthma, so we call control medicine, to prevent the attack, and the medicine like steroid and also long-acting beta agonist is used for this group, and another group is for rescue medicine for during the attack. So short-acting inhaled bronchodilator is also part of this group. Another thing that I have to share is about the asthma control test. What is the asthma control test? Because I use this for in this research. Asthma control test is the questionnaire used to know the degree of asthma controlling. So by knowing the asthma control is not, we can see whether the asthma is heavy or not. So by the rank value of ACT is 1 to 25. There is 5 questions in ACT, and we score it into and collect a score. And if the ACT value below 19 is categorized as uncontrolled asthma. And even if the ACT value of 19 to 24 is categorized as half control asthma, and ACT value as 25 is full control asthma. Full control asthma is more better than half control asthma. And this is about the species that the previous presenter has been mentioned before. Nigella sativa. Nigella sativa, literature review about this species. The seed of Nigella sativa is belong to the family Ranunculaceae, and commonly known as black seed or black cumin, caraway seed oils, and also have been habatus sauda. And in Indonesia, we call this jintan hitam. Jintan hitam, and this is the Mediterranean original plantation what we use in society as medicinal plant. And also this species has main chemical substance with multiple pharmacology activity, like mentioned before, and the major compound from this species is thymoquinone. And the review article has been shown many pharmacological effects of this species. And these are the active ingredients from the species. Thymoquinone is the major one, followed by thymoquinone, and also thymohydroquinone, cumin. Is a structure of this compound. And the traditional use of this species is East Arabian country, Indian and Europe, for what rank of therapeutic purpose, including modulator, antibacterial, anti-tumor, diuretic, and hypotensive also, and anti-diabetic as well as bronchodilator. Similar presentation. This is the clinical properties of this species. This species have been reported for the nephrotoxic inhibition, hepatoprotector, anti-inflammatory, allergic, antipyretic, antibacterial, so many pharmacological activity of this species. So many research have been reported. Focus on anti-inflammatory of this species. The black cumin has an anti-inflammatory and also active for bronchodilator by the mechanism suppress level of the eosinophils, and also immunoglobulin 1 and 2, and inhibition of the COX, cyclooxygenase enzyme, and also lipoxygenase enzyme inhibitor, and also the inhibition of prostaglandin level. So by this mechanism, this species can protect from inflammatory effect. And also the black cumin oil will reduce the calcium input into the cell, so it will reduce the granulation process on cell mass, and also the immunomodulator activity, which can stabilize at helper 1 and 2, which very close with inflammatory reaction. So before use this product to human, we have to know about the toxicology property of this species. So based on the report, literature report, the seed of character very low degree of the toxicity, and only two cases the contact determination into the individual have report following topical use, only two. And administration of either the seed extract or its oil has been shown not to induce significant adverse effect on liver or kidney function. So it will appear the beneficial effect of the use of the seed and timokinone may be related to the cytotoxic antioxidant action and to the effect of mediator inflammation. So the study showed that the supplement of this species up to dose 1 gram per kg supplement for a period of 28 days resulted in no change in liver enzyme level and did not cause toxicity effect on liver and renal function. And the low toxicity evident by the high LD50 value, key hepatic enzyme stability, and organ integrity suggests a wide margin of safety for therapeutic dose of Nigella. So based on that, because so many reported in preclinical and also but only few clinical study on this species for anti-inflammatory, bronchodilator, immunomodulator, and antihistamine. So we can predict that it can express for the asthma therapy by using this extract. What is the fact now? The black cumin or OMICS formulation, whether as a powder or oil, has been widely distributed in the market and with the low cost and consumed by people being registered as herbal medicine. So by that reason, we do the clinical, maybe the preliminary clinical study using control clinical in pulmonary clinic in Djamil Hospital, Padang. And for the next slide, it is about the method of the research. We study in the clinical test done by case control using the parallel design by independent treatment group and control group. You mean we have a control group and the treatment group. So by using this design, follow the research and the population of the patient in the pulmonary clinic of Djamil Hospital who fulfill the form inclusion in criteria. And the sample is the adult male and female patient who diagnosed with persistent asthma, proved by anamnesis and physical testing and also spirometry. And the study was done to unknown population and sampling was done by purposive sampling. So the sample includes for 24 people, including for the sample. So for research procedure, it's quite it's not easy in this camp. Before doing the research, we do the ethical clearance first. That we have to present inform the ethical commission of the medical faculty of Andalas University, and the patient who fulfill the inclusion criteria will be given a complete information about this research. And after the patient agree to be the sample of the research, the patient will be asked to answer the ACT asthma control test questionnaire and also do the blood test. And the patient then will divide into two groups for the control and treatment group. And the control group will only administered by standard therapy, controlling and bronchodilator from the doctor. And the treatment group will administered by standard therapy and black cumin oil that dose 60 mg per kg body weight per day. So after 1 month treatment, patient will be asked to answer again the question, and we collect the score and also do the blood testing again, and we compare between the control and also the treatment. This is the product that we use. The product should be registered in Indonesia FDA, and also we know the batch number and the expired date, and should be the halal label because we are the Muslim, most Muslim there, and the registration number of the FDA Indonesia, we call a PPOM. And as a result, we can see the different, after doing the research in 1 month, we got 20 people following the research. And from this table, we can see the control group in the last and the beginning of the research are categorized as half control asthma because the SAT score is around 19. But in the other hand, the treatment group in the beginning of the research were categorized as uncontrolled asthma since the SAT value below the 19. And fortunately, after treatment with this product or cumin oil, the categorized become a half control. So from uncontrolled to become half control. And SAT value was higher compared to the control group. So from this result, we can say that the black cumin oil can alter the asthma controlling level from uncontrolled into the half control asthma. And for the eosinophil value, we can see that in the blood, we can see that generally the asthma patient has higher blood eosinophil value because the normal value is 1 to 3%, but in the control it's 7, almost double. The normal value is 1 to 2%, but we see the difference between control and treatment. The eosinophil value become decreased from 6 to 5, but it is not significantly. So based on this, we can conclude that the black cumin oil formulation can alter the degree of asthma patient control level, proved by significant elevation of ACT value. And the thing is, the black cumin oil formulation was not significantly decreased of the eosinophil asthmatic patient during 1 month of treatment. So based on this conclusion, we suggest to further research need to be doing increasing the period of time of treatment. Last but not least, this is acknowledgement because I have a collaborator, Dr. Rafanal, and also myself. This is a clinical doctor that we collaborate for use them their patient to interfere by this research, and also my student Putri Ramadhani, and thanks to also director of hospital Djamil. Thank you very much.
When the patients were enrolled in the study, so they came there to the clinic with asthmatic problems.
Yes.
At that time, was that the first time they went to the physician?
No. The inclusion sample is 1 year asthma. So they have asthma for 1 year, at least for 1 year.
And at that time, they were not on any other drugs?
No. So the inclusion sample, no drug.
I'm just thinking, and the ethics committee, they was okay with putting on your alternative medicine and not giving them, let's say,
yeah, since
ethanol or some other beta agonist?
Yeah, the rule is the patient should receive standard therapy. So we use standard therapy and plus this product. For control, standard therapy only. So since we use standard therapy, they can allow us.
And what was the standard therapy?
Bronchodilator and also the prednisone, steroid for control. So since we use the standard therapy, they can allow us to interfere. But now, not easy to interfere because the rule is different.
Yeah, I think so.
Yeah.
Hello, thank you for an interesting talk. We have a lot of asthmatic patients in South Africa as well. I would like to know, if we have to buy this oil off the shelf, how much should we take, or do we have to dilute it in warm water or something?
Okay.
just a temporary relief of the asthma?
Yeah. The product, right?
Yes.
The product is in the capsule. It is a market product, readily in the market product. So one capsule, 1 day.
I'm not sure these capsules are available in my country. We may be able to purchase the oil in my country.
Okay. I'm not sure about that because based on the previous researcher, they use one capsule 60 mg per kg, 6 mg per kg per day. So that's the dose, the safety for using patient.
Okay, thank you.
And let's thank the speaker again.
Thank you very much.